Hello, my name is Raymond Owenbrink of Appalachian Wellness Center. Welcome to our practice. Our practice concentrates on addiction and on chronic inflammation. Let's talk about the inflammation first. Chronic inflammatory response syndrome, also known as CIRS, is something that happens to about 25% of the population. The phrase, genes load the gun, exposure pulls the trigger, is very appropriate to describe what happens here. 25% of the population is genetically susceptible, so once exposed to a trigger, the disease can take off. The disease manifests as such things as fibromyalgia, chronic fatigue syndrome, mold-related illness, chronic Lyme, and others. This disease causes a great deal of pain, fatigue, suffering, and it also shortens lifespan. The good news, however, is although most physicians do not recognize the fact, this disease could actually be stopped and even turned around following something known as the Shoemaker Protocol developed by Richie Shoemaker, a family physician from Pocomoke, Maryland, a brilliant guy. The first step, of course, would be the diagnosis. This is not too difficult, as a matter of fact. There's a vision test developed by the United States Air Force known as the Visual Contrast Sensitivity Test. It's available online at www.vcstest.com. It's very easily done on your home computer in the setting of your home. It takes about 10 minutes and costs about $10. For those that can't afford it, there are waivers that can be given. There's another way to make the diagnosis, and that is by medical history and looking at 37 different symptoms that are grouped into 13 clusters. So if you have a normal visual contrast sensitivity test, we should still take a look at your clusters to see where you fit as far as that part of the spectrum. If you have an abnormal test based on history, you could still have this disease despite having a normal vision test. The disease is treated with a combination of a lot of lab work, careful medical history, a lot of attention to details, and prescription medications and a few lifestyle changes. Now, this disease also causes a great deal of pain, as anybody who has had it is aware. Opiate addiction is another problem that a lot of these people have. People who have chronic pain tend to get prescribed pain medications. Addiction is a disease. So if you hit the genetic lottery where you've inherited the genetic makeup of addiction, once you start using, it lets the genie out of the bottle and it's off to the races. Problems begin. We treat not only opioid addiction, but addiction to other substances and behaviors. I'm a board-certified specialist in family medicine, addiction medicine, and I've also achieved recognition of excellence in Dr. Shoemaker's protocol and following his system of treating the CIRS disease. If you've been told that you've got fibromyalgia, chronic fatigue, Lyme, mold-related illness, or if you've been to a whole bunch of doctors and nobody can quite figure out what's wrong with you, but they say that you look okay and maybe you should see a psychiatrist because possibly this is all in your head, I would encourage you to take the vision test, spend some time on our website, AppWell.net, and see what you can learn about this disease, because with this disease, truly knowledge is power. Thank you for taking the time to listen to this and watch our video. I hope you'll take time as well to review the website. There's a lot of educational material there. And please don't hesitate to contact us. I could be reached at rjodo@appwell.net. Our phone number is 828-785-1850. Spend some time on our website. Anything that we can do to help you recover your health, we would very much like the opportunity to do. So please, if you think you might have this disease, do the vision test. If that's not quite convincing, call us for an appointment. Come in for a free consultation or just a free phone call, and we'll see what we can do to help clarify what's going on with you. Have a blessed day.